My dance company was in Vienna in 2015, and I noticed as I was walking that there was a sensation in my right hip. And this was like a new pain that I had never experienced before, and I knew something wasn't right.
Karen obviously is a very active, motivated individual, and she came to me about 1.5 years ago suffering from severe arthritis of both of her hips. And she wanted to get back to the full activity with her dance studio, and her very active lifestyle.
So I had my first replacement in August of 2018, it was a year ago, and the second one in May of 2019.
We do a lesser invasive type of approach with a very rapid rehab protocol. We call it the anterior hip replacement, where we go around the muscles rather than taking down any muscles. And all the studies show that especially working individuals, active individuals, will recover much quicker, less pain, shorter time on the walker, and overall ultimately much happier.
After my surgery, I took my 24 physical therapy sessions at the Miami Orthopedic and Sports Medicine Institute. I have to say, if you don't take your physical therapy very seriously, you're not going to heal well.
Physical therapy is really important in everybody's case, but especially in her case, because of how active she is and the type of work she does with the dance studio, and also for her own personal interest. What's nice is that we have an amazing group of physical therapists who do some of the things that she does, and so her specific therapist, Cynthia, is a well-known dancer and has a very targeted program specific to dancers. She understands what they need and what their demands are, and can really work with these specific patients to get them back to the activity she wants. The favorite part of my job is working with people like Karen, seeing her recover, seeing her get back to her physical activity, getting back to the things she loves to do, and then allowing her to work with other people. In the end, this is why we do what we do, and this is why I love doing hip surgery.